Welcome, everybody, to the LionHearted Podcast, where courage meets purpose and every conversation is an opportunity to inspire and ignite the lion within us. Hence the name of my podcast, The LionHearted. I'm Dr. Steve Rasner, your host, and I got to tell you something cool about doing these podcasts, which I might have said before, I don't know. I get to kind of get to know really cool people in dentistry that I knew of, and I never, how many people do you sit down with for 45 minutes or an hour and really just have a conversation about dentistry, about life? Well, tonight's guest is one of those guys because I've known about him for a very long time, and all I've heard is amazing positive things. And, and we meet for a few minutes on the phone, obviously, before I do a live podcast. And I couldn't be more happy tonight for the purpose that I got to know him more, and I have such admiration and respect for him, than Dr.Victor Martel from Palm Beach. Join me on October 18th and 19th for 2+ days of inspiration and real business training. This is the course that changes everything. Attendance is limited. Register now. Florida. Vic, welcome to the show.
Thank you, Steve. It's a pleasure. Thank you for having me.
Yeah, it's absolutely my pleasure. And as I've had some really neat people on the show, as I've said before, Picos and Bill Strupp, and Vic knows Strupp as well as I do,
and Picos too. Yeah.
You know Picos, do you? Okay.
Yeah. Oh yeah. Look, Mike is such a great human being. Yeah. He's.
So what's cool about Vic is that, to me, is that he represents one of those guys in dentistry. Then eventually we're going to be replaced with a newer generation that just deeply cares about subjects that I think are important for you to master, and cares about dentistry. I mean, listen, he's not as old as I am, but he could sail into the sunset, and he could forget about dentistry. And I don't know whether you golf or not. You golf?
Oh yeah. Yeah.
Okay, there's a golfer. I never golfed, by the way. And I'd never golfed. There's only so many hours in a day for me. I kind of wish I had, because so many people I know, it's such a cool activity to do, but I never did.
I don't know, I think it makes you a little crazy, Steve. So.
Yeah. So I was telling Vic before, I'm back. This is reality, right? And you guys love this. I'm back in my operatory. It's Wednesday. It's August the 7th. And I'm actually examining a patient, and I look at the clock and it says 5:05. What do you mean? I got a podcast 5 minutes ago. So that's the reality that I try to bring to the show. Events like me, because I'm not events, situations that I deal with every day because I'm still practicing 3 days a week, and guys that I think can bring information to you that will make your journey have less bumps than ours had. So let's get to it, Vic.
Yep, absolutely.
Victor's history, they don't care probably. So but for edification, you went to dental school where, and you graduated when?
Yeah, well, went to dental school at what's now Rutgers, but was UMDNJ, or University of Medicine and Dentistry, New Jersey in Newark. Graduated in 1984. Was born and raised here in Palm Beach area. So as soon as I grabbed my diploma, I threw it in my car and came running back to the Palm Beach area, because Newark wasn't one of my favorite places to hang
Palm
out.
Beach or Newark. Where am I going to practice?
Well, on the other hand, Palm Beach is a great place to learn. I mean, Newark was a great place to learn dentistry. Palm Beach was a great place to do dentistry. So completely different things.
So you are a general dentist, right?
Yes.
And you've been in private practice
private practice since 1984, and then, but kind of like a lot of us at this age, I sold my practice about 2 years ago now, and stayed on as an associate for a year and a half, and that was really interesting, being an owner all those years. Completely different mindset. It was a little kind of surprising to me. And then now I have a really good friend that has an office up, about Palm Beach Gardens area. And when I have VIP patients that still want to see me, I go up there and I do their dentistry. And so I keep current, but nowhere near as where I was.
So Vic's wheelhouse for you guys that don't know about the Martel Academy is the prosthetics and comprehensive treatment planning that involves implant dentistry. I mean, I love that because, it's very easy to overlook that, right? It's very easy to go through a surgical continuum, like the Mish Institute, like, all of them, Maxi Continuum. And you can say to yourself, well, I'll learn about the prosthetics somewhere else, YouTube, a book, whatever. And there is a lot of information on the prosthetics of implants, but you can't begin to be successful in long-term implant dentistry without having prosthetic protocols to follow. So
Correct.
how did you get into that, Vic?
Well, interestingly enough, this is, I'm a lot like you. I kind of tell my horror stories as much as I tell my good things about my practice. But I was probably 8-10 years in practice doing a lot of cosmetic work. And interestingly enough, seeing veneers break and things chip and I had no idea how or why. So I happened to know Frank Spear at the time, and we're talking, and he says, "Vic, how much do you know about occlusion?" And I go, "What does that have to do with veneers?" It was one of those silly things, the silly questions.
Yeah, I like that.
So then I actually, went and took all of Dawson, and I went back and forth and did all of Dawson. Within 6 months, I finished the course. Did Pankey, did Frank's stuff, did a little bit of John Coyce's stuff. So in all that, as you know, when you learn occlusion, you learn how to put things back together again in feeling cases and things like that. So ultimately, my practice evolved into this more of almost like a prosthetic practice because of that situation. So through that, just ironically, Biomet back in the day, 3i, was literally, 2 miles up the road from my office.
2 miles.
And I would go take courses.
Okay.
Yeah, they're in Palm Beach Gardens.
Okay.
And there still are. Their main headquarters is now there's Zimmer Biomet or ZimV, but they were only 3i or Biomet at the time. And I'd go up there for lectures, and I used to have quite a few of the people that work there in the education department and other places ask me to, would I be interested in lecturing? Because what I noticed, and you'd appreciate this, Steve, is that every time I went to a lecture, it was about prosthetics. It was always a prosthodontist teaching.
Right.
And that's a nice thing. But you know what? Here's what happens in the audience as a general dentist. Well, yeah, he's a prosthodontist. I'll never be able to do that. Yeah, he can do that because he's Frank Spear. So I would sit there and I would listen, but I never really absorbed it because I always had this little chip on my shoulder. It's like, yeah, well, they have more training than me. I'll never be able to grasp it. So ultimately, they started asking me to lecture, and first thing they asked me is, how did I like the courses that they offered? And I go, and I was really honest, and as you'll find out when you get to know me better, I was really transparent. I go, they're okay. And they were surprised that I said that. And they said, why do you only think they're okay? And I said, well, because it's a prosthodontist, and I can't really relate because I'm a GP. So ultimately, they said, would you like to put some lectures together as a GP doing implant prosthetics? And I go, I'd love to. So that's when I first started about 15, 16 years ago. And then, as you know, the more you teach, the more you learn. Sure. And ultimately, I got to the point where I was traveling 40 weeks a year, lecturing on the weekends, and be very, very busy. And then eventually I developed my own program because what I found was the programs that were sponsored by implant companies became too commercial. I had to kind of sell parts and pieces, which I never liked, because I just wanted to teach concepts, whether it was occlusion. And what I tried to, and you know how Carl Misch used to be back in the day. He would teach a concept. He didn't care whether you were using a blade or a cylinder or a sub. It was always about, the dentistry. And so that's what I brought and I changed the course completely, and I brought it to Straumann, and we developed an entire program which took off exponentially over the years. And that's how all this started to occur. So now I still do it. I do it independently now for surgeons. I'm doing a lot for U.S. oral surgery now, and starting up their education company, part of their department.
So in your academy, in the Martel Academy,
yeah.
is it one course? Is it a series of courses?
No, well, actually, there's multiple courses. I actually have other faculty as well, but my course that I'm referring to right now, the mini residency program is what we call it, is kind of like a continuum of 5 sessions that I travel around the country. If you were the surgeon, I would go up there 5 times over the course of maybe 12 months. And we start at the very basics of knowing implant dentistry and what kind of patients it develops into, and then getting into the prosthetics of how to do a hybrid, how to do a bar over denture, how to do an anterior tissue shaping on an anterior, and therefore teaching them the process of step by step. Because one of the things, and I think I said to you in one of my calls with you, is what I've learned about dentistry, and this is what drove these programs, is 3 things that I learned. A dentist will never treatment plan something they don't know how to do. They just won't, because it's something that doesn't come to mind.
Sure.
Number 2, most dentists, GPs, don't know how to comprehensively treatment plan. It's not something we're taught in dental school. There's so much time in dental school in 4 years. And then lastly, they don't. Not only will they not treatment plan it, they don't even recognize it in their office when they see it in hygiene. So this was the core of my program, is teaching them how to comprehensively treatment plan, teaching them how to recognize it, and then lastly, teaching them how to do it. And when you put those 3 things together, I think the office has become much more a powerhouse of how to comprehensively treatment plan implant dentistry. And what's nice about what I do is, because I have a lot of occlusion knowledge, it bleeds over into worn dentition cases, and we can do just about anything. But my Martel Academy has courses on photography, hygiene,
right, okay,
occlusion. Yeah, it's a lot of different things.
So one thing also very interesting about Vic is that he is involved, which I'm not going to get to yet, but I'm saying this on purpose because I want to ask him another question,
Sure.
He's involved with an extraordinary amount of legal work, and he's
Right.
done on both sides of the bench. He's defended dentists, and I think that's his primary focus, that have been sued.
Correct.
And, he's had the other side as well. And I'm going to ask him about that. So that's a very important part of this podcast. Your practice, your future, and how vulnerable you are to lawsuits, and,
Right.
and what you can do to arm yourself with protection. I think it's very important that you know that.
Yep.
But before I do that, what kind of things do you see that are flagrantly violating, and you can tie this in to your legal experience if you want, that get dentists in trouble occlusally? Is that even a question you can answer?
Oh, sure. Yeah. It's, I laugh because I'm such a, for lack of a better way of saying it, I'm just an occlusion nerd. That's just, my practice ran that way. I've read every article on it, and that's how I practiced for a long time. And there's so many things that can happen on a day-to-day basis. If I think, and this is my bias, obviously, is I think foundationally, occlusion is the foundation of dentistry. And when you learn it well, the treatment plans change, things become more comprehensive. But I've had cases where I see dentists getting in trouble just because simple things. They do 6 veneers on 7 through 10, and they, just like me, they can't figure out why they're constantly breaking. Right? Those are the frustrating points. Those aren't necessarily legal issues. I guess they could be, but that's the dentistry that makes dentistry very frustrating. Pete Dawson used to teach me years and years ago. He would ask his audiences, "What's the most frustrating part of dentistry?" And dentists would say in the audience, "Oh, my team members, the labs." And he goes, "No, the reality of it is the most frustrating part of dentistry is the unpredictability of dentistry."
Yeah.
Because it becomes the scary aspect of it. You know what I mean? If me and you did a case, and every time Mrs. Jones walks into the office, you're thinking, "Oh my gosh, I don't really want to see her because did one of her crowns break that I did?" In other words, you take on this self-responsibility because maybe when you did it, you didn't know as much as you do now. And that becomes a problem because it becomes a hot spot in the sense where that's where dentists are losing money as well as stomach lining and heart muscle, because a redo of a case is way more expensive, as you know, than doing the case that lasts a long time.
Well, you bring up two good points I want to interject something with, and that is one of the principles when I present these days that I try to implore my audience of dentists to do is to add time to all the procedures. And I get it. It's a complete turnoff for you because I'm sitting here telling you, slow down and you'll make more money. Okay, that's what
Absolutely.
I said. Add a half an hour to all your procedures. And that's really hard, and I get it. I don't even know whether I would have followed that advice as a young dentist. I don't.
Yep.
But here's why. That's the beauty, I hope, of listening to a lion-hearted dentist like me and my guests, because they're all lion-hearted, is because you're learning from our mistakes, okay? When
Absolutely.
you slow down, first of all, nobody listening right now that has their own practice ever calculates how much time in that day it takes you out of your day to examine hygiene patients. See, oral surgeons don't have to do that.
Right.
Endodontists don't have to do that. Periodontists do. So if you have 8 patients a day, and I have, actually, quite honestly, I have 3 hygienists. So if they see 1 patient an hour, that is 8 times 3, it's 24 patients. You know I'm going to spend 5 minutes on those patients. And no, I don't have to see every single patient. I get it. And trust me, I figured out methods and ways to know exactly who I have to see before that day starts. But if you go in there on half of them, you go in on 12 patients, and you go in for 5 minutes, hell, it takes 2 minutes to go from wherever I am to go in, wash my hands, put gloves on. That's 2 minutes times, what'd I say?
24?
Yeah, 2 minutes times 24. Where's that 48 minutes come from? How'd you calculate that? And you know what happens? You make bad treatment planning decisions.
Absolutely.
So just that's what I mean when I told you slow down and you'll make more money. Because Vic's right. It is devastating to your morale. It's devastating to everything, to the patient. Even when you redo work that was your fault at no cost, because you have to if it's your fault. Here's the bottom line. The biggest challenge in dentistry for most of the GPs in the world, and to some extent to the specialist, is that the patients you examine have less money available than they actually need to do it the way you would do it if money wasn't an issue. You think about that statement. Because what does that mean? It means an incredible amount of times you're compromising to an extent what you should do, really, for that patient. So think about it. Patient walks in your office, like Vic said, and they want veneers. It's already sold. They want them. They've seen your veneers on somebody else. And you're going to, first of all, should you really make it 7 through 10? Or does your smile demand that you go back further? Number 2, where's the occlusion fit? You always should ask yourself that question, no matter what you're doing. Where's the occlusion fit into this case I'm treatment planning, right? Because if they have a traumatic occlusion, if they have a malocclusion, if you can't, how about if you have to open up vertical? Just something as obvious as that. And you skip that because they can't, that's a tremendous difference to provide a patient full coverage crowns or onlays or whatever to reopen their vertical to what it used to be so they don't slam their front teeth. A lot of patients wouldn't be able to afford that. So you wouldn't get the veneer case. You have to do and treatment plan the cases according to all the possible grenades that could go off. And a patient with a collapsed vertical dimension that wants their smile to look better, that's not willing to treat the rest of it, that's a grenade.
Absolutely. Yeah.
Right?
To say to your point, which is so true, and what I talk about at lectures, especially in my occlusion courses, is, and I think this is hard for young general dentists, and maybe it's because we're established that we don't have this issue as much, but it's just as important to know who to say no to than it is to get the case.
Oh, absolutely.
You know what I mean? Because I'm telling you, and which leads me a little, we'll eventually get there, to the legal stuff. And because if a case has gone wrong, and some dentists did the case and they're happy they made $20,000 on the case, but the patient's miserable, they're trying to sue you or whatever it happens to be. I literally say to these dentists, let me explain something to you. You would give me $50,000 to make it go away. So you're much better off just saying, you know what, when you're ready, we'll do this work, but until you're ready, let's just hold off. Because ultimately, getting into the middle of a case because it's only for the financial reasons, you'll regret that. As soon as that case goes wrong, you'll regret it for the rest of your career.
Yeah, one of the greatest gems you could ever get, in my opinion. I've done this podcast since 2018, is understanding how liberating it is, how much celebration you should really have when you don't get a case that would have required you to compromise to get the case, to not reopen vertical, to not equilibrate the occlusion, which could involve a lot of things, to not have the patient have ortho first. I mean, that's a buzzkill. You're sitting there. We know what it feels like to be in the month of August and nobody's coming in for whatever reason. And lo and behold, somebody out wherever they came from is willing to spend, let's just say it, $10,000, whatever it is, to veneers, 4 teeth, 6 teeth, whatever your fees are. But they don't have $35,000 or whatever it costs to really address everything that case needs. You'll wish a year. It's happened to me. I'm telling you, I've been in those cases.
Happened to all of us. Yep. Steve, you remember, because you know Carl Misch as much as I did. And some of the things he's quoted to me over the years just is still burned into my brain.
I love them.
And one of the ones he says, which is famous, it's better to see the back of a patient's head once than their face over and over and over again. And the minute a dentist learns that, dentistry is much less stressful than it is on the other side of that coin.
Yeah, and listen, don't give me the rap that we're saying this because we're older guys and we can talk like that because I'm trying to save you.
Absolutely.
Angst, man. Because guess what happens? Yeah, you'll be successful anyway if you're a good dentist. If you're a true, if you're really passionate about dentistry, you commit to a lifetime of CE. Yeah, you'll get through those mistakes you made, but why do it? It really did take me. It's true. It took me halfway through my career to realize, man, it does feel good to not be stuck with somebody that I've been stuck with before because I knew I compromised the case.
Yeah, it took me about 10 years to learn that.
Yeah.
It was I mean, and it was my point where things started failing and I didn't want to go to work. And that's when I started learning how to avoid those things. And you know this as well as I do. I made much more money in my practice when I saw 3 or 4 patients in a day than if I saw 15.
Yeah.
Because I took the time to treatment plan. I took the time to do the cases the way I thought they would last a long time. And ultimately, it makes your day much less stressful. So.
Yeah. Well, let's turn the page for a minute because I find it fascinating because I don't really know anybody personally other than you that does get involved with litigation against a dentist.
Right.
So tell us how that happened. How did you get into that?
Okay, well, it's probably been about the same, maybe a little longer. I used to have 2 partners, actually I was 2 partners, a partner and then another associate. And one of my partners at the time was getting, he had a lawsuit brought up against him. And fortunately for us, it was something, he didn't do anything wrong. I knew what had happened, the circumstances. But his attorney, who was defending him, would come into the office to have conversations with him and do little depositions and review charts and things. And every time they would spend some time together after they were done, the attorney would sit and talk to me about, shoot the stuff and about the day. And he just happened to ask me, because of our conversations, would you ever want to consider reviewing cases, to defend dentists?
Yeah.
And that's how it all started. It was 100% defense for many, many years. And I said, listen, I'd be happy to, as long as you with under one circumstance. I'll read the case, and I'm going to be really honest with you. If I think that you have a problem, I'll let you know. If I think it's a good case and you're not going to lose, I'll let you know. And through that, it became this thing that I was eventually asked to do some cases every now and then on the plaintiff side. but ultimately it got to the point where, and and I think I may have told you this on the phone call, Steve, which is really not good, but it's the way it is years ago when I first started doing this, I might have reviewed 6 cases a year, maybe. I'm probably doing close to a half a dozen a month.
So you see now, Dr. Martel reviews it, in case you're just tuning in at this point and you went out of the room to eat your dinner. He reviews cases, 15, did you say? How many a month?
Oh, about 6 a month.
Okay.
New cases.
Yeah. 6 cases a month. Remember, we're talking about litigation against one of us, right? And he reviews it to see if it's defensible, to be quite honest. So let's
Correct.
talk about it. What do you see as trouble and that would prevent a dentist from being in a situation that's not defensible?
Well, the biggest one, and I'm sure people have heard this, but in my case, because I experience it very, very frequently, is even if you didn't do anything wrong, if you have horrible records, it makes it very difficult for me. It really does.
So what qualifies as horrible records?
Well, number one, something that you and I can relate to, being in dentistry this long. Every dentist is, you told me, I think you dictated them, but I wrote my charts out, right? And if you had bad writing and I can't read it, you already have one strike against you, because now I'm trying to take my time to read your chicken scratches, and that's one side of it. That's just it's not legible.
Okay.
That's something. But mostly, it's the incompleteness of them. I think, and I think it's gotten worse. And the reason it's gotten worse is now that we have digital charts, things tend to be templated too much. They kind of use templates, and when dentists use templates, and I understand you're seeing lots of patients in a day and you have to review these charts and write them out or dictate them out, whatever you do. I understand it gets tiresome and things, but you have no clue how important your record is. And see, here's the interesting thing. If, God forbid, Steve Rasner ever got sued and they asked me to defend your case and read it, I am never allowed to speak to you, ever. So I can't call you up and go, hey, Steve, tell me about what happened. I can't do that.
You can't do that as the role that you play?
Correct.
Okay. All right, go ahead.
So the only thing I have is your record.
Okay. Wow.
Now, additionally, I might have, if you gave it during the process, you maybe gave a deposition. And I'm not even at the deposition. I have to read a typed out version of your deposition. So the only things I have are the record, the patient's complaint, possibly their deposition, and your deposition. That's all I can do. I can't call you up and go, all right, Steve, I understand, but just tell me your side of the, can't do it. So if you imagine how important that record is then.
Okay. So
it has to be an exact snapshot of what really happened that day, or I'm kind of lost.
So I'm really trying to tune into these guys listening, because this is a critical subject, because a lot of LionHearted dentists do advanced procedures, so they're doing surgeries. And so if the templates are too cookie cutter, are there, and nobody wants to type out every single thing they do. I do, by the way. And it is exhausting and time consuming. Is there any company that has good, how do you get around that then? How do you get around? Yeah.
That's a good question. There's something that's, and I don't know if and I'm going to give you the exact, an example of it, but have you heard of this? And, we didn't even talk about it last time we spoke. Have you heard of this new, for lack of a better word, invention called Applaud, Plaud? Okay, picture this, which I think is absolutely amazing. And I think eventually if we bring it into dentistry, it's going to solve a lot of these issues. Applaud is something about the size of a credit card.
Okay.
It's a voice recorder.
All right.
But it's a voice recorder on steroids, because as soon as you're done with that conversation, you hit a button and it gives you an exact transcript of the conversation, and it can summarize the conversation with bullet points. And you can buy one on Amazon for $150. They're not expensive, right? But imagine this. You're the patient. I'm talking to you. I look at you and I go, do you mind if I record this?
Oh, I love it.
Now, you can record the entire conversation, what they say, what you say, And all of a sudden, when the conversation ends, you hit transcript.
Time out.
It gives you
here's a takeaway. You've got to listen. I'm telling you, I'm doing it.
Yeah.
Dr. Martel just said he represents dentists, reads their cases, sees if they have a defensible case. The number one thing he would tell you to do is get great legal records. One way avenue to that, I asked him, how do you do that? Because templating is too generic. He's saying get a hold of PLAUD, PL.
A lot of the young guys already know what that is. I just don't know if they're using it yet.
Okay. And
it's amazing technology. It's all AI generated. So it can not only give you a transcript, you can hit summarize, and it summarizes the conversation as opposed to the entire transcript. For example, if you were giving a lecture,
I'm laughing because I'm embarrassed that I should have been using this about 5 years ago. Go ahead.
Let's say you had a lecture and everybody in the room had applaud. You wouldn't need any notes anymore to hand out to them. They would hit notes. Yeah. It comes out and you can hit college transcript notes, lecture notes, and it creates an outline exactly the way they would want it.
Okay, beautiful.
And you can create summaries and bullet points at the same time. So if I was going to be doing this today, I would actually have applaud in every room and ask permission to record, because now you have the page. Now you're not writing down, patient said this, I said this, I explained risk and benefits. It's there.
Sure.
Because the way I wrote my notes was verbatim, and I had my assistant writing as I was working. That's just how I did it.
Well, I love that. And I think you should be comfortable, because it just happened. It's happened to me more and more frequently as I've been to various doctors in the last 2 years. It's them saying at the beginning of it, is it okay by you if I record this? It was brilliant. I mean, I remember.
Well, think about it. It should be a red flag to say if they say no, right? I mean, it's like, why wouldn't want you to record it?
I remember one case I did. Imagine this. I'm talking about a partial denture. I'm talking about 20 years ago, that I went through the whole procedure. Like, I extracted their teeth. They're wearing a provisional for 3 months. I take the final impressions for the final prostheses. Day of insert, they say to me, you mean it comes in and out? That's what they say to me. Yeah.
I've been there.
Yeah. So okay. So obviously records well taken.
Yes.
What other things can LionHearts and any dentist do?
Well, and you know what? And it goes towards what you do. I know you do really in-depth surgery courses, which I think are fantastic because you're teaching these GPs. And one of the things I try to explain to GPs, especially, is if you're going to do a procedure, whatever that procedure is, and this is just my philosophy, good or bad or different, just get really, really good at it.
Sure.
You in the old adage, and to me it's true, you can't be a jack of all trades.
Yeah.
You're a jack of all trades, you're a master at none, right? I wanted to learn occlusion. I did Pankey, Dawson, Spear. I wanted to learn prosthetic. I did this and this and this. I took Carl Misch's prosthetic course. So interestingly enough, another example, Steve, you remember Steve Buchanan out in Santa Barbara, the endodontist?
The guy, yeah.
I went and took his course. Back in the day, it cost me a fortune. I flew to Santa Barbara. You know what I learned? I don't like endo.
Exactly.
But I took the course, right? Because I said, if I want to take it, I might as well learn from the best.
Sure.
And that's what I feel. I think dentists I see, and it's a challenge because these poor young guys or women are in a lot of debt. They need to pay their bills, and they will do just about any treatment plan or procedure available to them because they're trying to pay their bills. And unfortunately, sometimes that'll bite them because it's a situation where, the old thing, if you're digging a hole and you don't know where you're going, you better just stop digging, because ultimately that will get you in trouble.
Well,
doing procedures that you're not trained in is a biggie.
And my response to that is this: if most colleagues would just commit to a comprehensive exam, your version, you don't have to use my version, of a comprehensive exam. And my version is I am very vigilant about, no matter what they come in for, I am always going to look at these 5 arenas. And the arenas are the health of the periodontium, the health of every tooth in their mouth. They didn't come in for me to examine every tooth in their mouth, but they know I'm going to do that because it's part of what we call the screen, which is set up by my new patient coordinator, before they ever set foot here. Why do I do that? It's in my protocol book, by the way. I do it because I got tired of somebody. It didn't happen that often, but I don't even want it to happen once for somebody to come in and my hygienist tell me, oh, they don't want a whole exam and they don't want all these x-rays and radiographs. They just want their tooth removed, right? Or they just want this. So we started implementing that as part of our screen so they know I'm going to do that. So there's no surprise. So I examine every tooth in their mouth, all the missing teeth, some perfunctory examination of the status of their muscles and joints, right?
Yep.
And then actually the last thing I look at, unless it's what they specifically called for, is their aesthetics. Where does that fit in? And if you did that for real, if you just could commit to that for 1 month, you would find yourself so much busier than you are, that you wouldn't have to learn every single procedure that's out
exactly
there.
Right. Yep.
You wouldn't have 100%. To do it. And I swear that's as simple as my philosophy has been for 20 years.
Yep.
I took a course, and I'll probably get crushed for this, but it's okay. I took a course on pterygoids and zygomas. I've done surgery for 30 years, and a lot of what I thought was advanced, from lateral sinus window lifts to ramus grafts and things like this. And, I thought, let me see what this zygoma pterygoid is about. You know what it's about? It's about something I don't want to do. That's what
exactly.
That's what it's about, right? I get it. You don't have to be the king of everything.
Absolutely. Yeah. I say the same thing, Steve. I said, you know what, if you and this is why my courses become such, and what happens with general dentists that take my courses, when they're there the first session, they kind of get it, but they're not so excited about it.
Right.
Yet. And then when I get into the sessions where we're doing comprehensive treatment planning and they see how these treatment plans grow from these 1 or 2 implants to maybe this full mouth, this is when I tell them, you know what, if you do this on every patient, a comprehensive treatment, you don't need a lot of new patients in your practice.
Right.
You really don't.
It's so true.
Get really good. And then I have a really good, referral circle that I kind of like when I need oral surgery and things like that. And I do what I do really well, and my specialists do what they do really well. And I'm busy enough doing that. I'm not chasing procedures, in other words.
Sure. Yeah. So let's get back to anything.
Yes.
We're going to start to wrap. Anything you have?
Yeah. Lastly, I would say this, because, it's number one, it's your records, period. Number two, getting good at the procedures that you want to do. And then, as everybody's always heard, but it's so true, people don't sue people they like.
I was going to ask you about that. So true.
It's all about relationship.
Man.
That's why you and I, those things probably never popped up in our lives, thank God, because you know how to treat people. The relationship is first. The money becomes second. And therefore, people don't litigate people they care about. They really don't.
Yeah. So I love that you said that, Vic. You guys are all going to develop your philosophy of how you want to run your practice, right? And some people listen, I have an endodontist that I send my patients to. If he does an endo and he's superb and that tooth breaks off and it's non-restorable 1 week later, right? Even though it's not his fault, and it isn't, that's it. He doesn't compensate them, doesn't return anything. And there's even been a couple cases where I referred an endo and he should have called me, which he has done other times, and said, you know what, I don't think you should do endo here. I think you're going to have a really hard time restoring it unless you extrude it with ortho. And that wouldn't offend me if he said that to me. So my philosophy along that thought process has always been this, Vic. If I at all think that I could have given a better treatment plan on something that's failed, if I think it is my fault because maybe I did compromise, as I alluded to earlier in this podcast, and I should have done something else. I should have opened up their vertical. I should have restored some other teeth and not just what they asked me to do. If I thought it was on me at any level And if I wasn't sure, I always ran my practice that I gave the patient the benefit of the doubt. I did. And it just felt better to me. It always did.
Mm-hmm.
And as a result of that, I haven't been sued. And my patients are exactly what you said. It is, This is a relationship-based practice. And when I say that to you, my personal contribution to the relationship is that I think it'd be very hard for them to find somebody more fair, because you're going to have failures, guys. I don't care how great of a dentist you are. And there's going to come a point where you have to say, am I doing this over at no cost, or am I doing this over and charging them for it? And there's a lot of well-known dentists that are completely the opposite, right?
Right.
You got to decide where it's comfortable for you. And I'm not telling you to give away your dentistry to the patient. I'm not talking about the patient that you do a restorative work on and disappears for 3 years and comes back in your practice. I'm not including that. Yeah, you're right. That's a great advice, Vic.
Yeah, it's, and I'll leave everybody with this, which is, that's why I think you and I get along and click, is that we're passionate about what we do. And dentistry to us isn't just, yes, it's your job. Yes, it's what your profession is. But there's got to be more people in life. And we were very fortunate, you and I, because we learned from passionate people. We learned from the Dawsons and the Mishes and the Spears and everything. And I hope that there's people in dentistry today that are like that for people, because I would be nowhere without my mentors. That's just the way my career went. And one of the best advice I could ever give a young dentist is, you can take another course. You find some great mentors in your life, people you respect, people that will be honest with you, and the people that are passionate about the profession. When you have that, you have everything.
Vic, that was a home run, my man. I'm so glad you did. I have some other exciting news about Dr. Martel, because next podcast, he's interviewing me. Hi, I'm Dr. Steve Rasner. Join me on October 18th and 19th at the historic, elegant Rittenhouse Hotel in Center City, Philadelphia, for 2+ days of inspiration, motivation, and real business training. LionHearted Live is the ultimate business course for dentists. Being successful in the business of dentistry isn't about how many CE courses you take or your social media following. It's about effectively leading a team of people through a busy day that is fun, rewarding, and profitable, and then repeating it day after day. Are you struggling with getting new patients to say yes to comprehensive treatment? Having trouble getting paid up front? Are you connecting with your team, or do you have a revolving door of staff? LionHearted Live is a seminar for you. I'm passionate about teaching you to be a better leader in your practice and in life as well. This is the course that changes everything. Attendance is limited, so register now.